welcome back. His specialty is pain management, and his goal is to treat pain without narcotics. Joined by Dr. Danesh, who will talk about some ways we can do that. And not only do we have today, but we're going to be revisiting this topic as time moves on here, Dr. Danesh. And we certainly appreciate your expertise in this. Maybe just give folks a quick primer on your background and area of study.
Yeah, so a lot of pain docs go through anesthesia training because really anesthesia is the science of not just physiology of body, but also understanding nerves and understanding how pain is relayed in the body. So my background, I did my residency at Hopkins, at Johns Hopkins, and then I went into fellowship at MD Anderson. So MD Anderson is a big cancer institute that looks at a variety of different conditions that will inevitably have some pain. So it's a very complex understanding of nerves in the body and how they transmit pain to the brain.
Well, it's a prestigious organization you're describing here, so we want to take advantage of that expertise and dive into this topic. And so the goal is to try to move away, if not completely away, from narcotics. And where do we start with that?
Well, I mean, you know, pain medications, narcotics are helpful in an acute setting, but if you take it for a long period of time, you lose the effect, and we want to preserve those medications for the times where it's really an emergency or necessary. So we try to isolate the nerves that transmit the pain and in some capacity numb them. It can be a temporary numbing, it can be long-term, but we're not killing the nerve. All we're doing is we're just reducing the volume of that nerve rather than just kind of pushing the mute button on your stereo.
I see. Something I've always been curious with when doctors ask, you know, what pain level are you at? Give me a number 1 to 10. I mean, that seems like it could be all over the place because everyone has a different interpretation of that.
Absolutely. I mean, when you have pain, it can be something small or big, and it's hard to put a number on that. But really, it's more than just the number. We're really trying to understand the type of pain, because if you notice, like if you stub your toe, you burn your finger, you can call both of those pain, but they're very different. And the treatments for those are very different as well.
Very good. Well, this is a big topic, as we were discussing earlier, and we look forward to time ahead where we can discuss it in greater detail. How can folks learn more information, kind of study up, and maybe have some questions ready for you as time marches on? So
there's a lot of information on the internet, but it's hard to find reliable information. We have a lot of, I'm glad you guys had that social media story. We have a lot of social media outlets, and we try to put out articles that are really well vetted and well trusted. So knowledge is power.
Very good.
Yeah.
All right. Well, there's a website at the bottom of your screen there. Check that out for more information. And Dr. Danesh, we certainly appreciate the info. Look forward to your next visit with us.
I'm really happy being here. Thank you.
We appreciate it. We're back with more after this. Stick around, please.
I'm Dr. Danesh, pain management specialist. When I learned about the opiate epidemic in Kentucky and how it misrepresents what I do in pain management, I was appalled. My parents created one of the first multidisciplinary pain clinics in Kentucky over 20 years ago. I joined them after finishing training at Johns Hopkins and MD Anderson. At Pain Management Medicine, we treat the root cause of pain, not just numb you with narcotics. My life is dedicated to understanding the body when it hurts. Pain Management Medicine, seeking the source behind your pain.
Welcome back. Those who live with pain often rely on a daily dose of medications to make them functional, but those potent drugs come with quite a few risks, the potential for abuse and addiction among them. So we're joined by Dr. Danesh Mazlumdost. He's with Pain Management Medicine and here to give us a little bit more insight into this issue. And thank you so much, Dr. Danesh, for coming in.
Well, thank you for having me.
I'm sure you've seen both sides of this pain management issue. Using medications. For some people, it's really helped improve their lives. Others, it may have taken it in a downhill slope, right?
Yeah, well, you know, traditionally, I think people thought of as pain management as kind of the last line. If everything else fails, well, at least we have pain management.
Right.
But really, the newer fellowship-trained, the board-certified pain physicians are better to serve your patient at the front line. we're really good figure out problem solvers. We can figure out what's wrong and how to fix it, and if we can't fix it, then our next best bet is to figure out how we can create a detour in the nervous system so that it just never makes it to the brain.
Well, you manage kind of the bad reputation of pain clinics. They're, in many people's minds, they're just pushing pills out at people and trying to medicate instead of fix the root of the problem. So how do you guys get down to the root of the problem?
So it's a diagnostic process.
Okay.
I mean, pain is not, it's not just your body hurting, it's your body trying to tell you something's wrong. So we're experts in the nervous system. We figure out what that pain signal is trying to tell you. If you notice, like if you stub your toe, if you burn your finger, if you have a paper cut, you can call all of that pain.
Right.
But they just feel very different.
Sure.
And the treatments for those are going to be very different as well.
So if somebody were to come into a pain clinic such as yours, what's different than the other pain clinics that they might be used to?
It's a diagnostic process. We try to figure out what the root of the pain is. We try to be your I guess, your foreign language dictionary with your body, trying to understand what the
asking more
questions
questions and everything like that.
Asking more questions, doing diagnostic interventions, figuring out really what the root of the problem is.
Okay, very good. So if folks do wanted to come into your clinic and ask some more questions of you, and you can get some questions out of them, what's the best way to contact you?
Well, they can ask their physician to give us a referral. They can call themselves, but usually when we do that, we just do interventional management. We don't do medication management as well. I mean, narcotic management.
Sure, absolutely. Right. You guys are located here in Lexington, right? Okay, and the website is painmm.com if you would like more information. Dr. Danesh, thank you so much for coming in
and
talking with me. We appreciate it.
I appreciate it.
We're back with more right after this.
Welcome back. So you can't bear that nagging pain any longer, but you're not sure where to turn to put it at ease. Who do you look for? Well, the man right here is a good start. We've got our friend Dr. Danesh here. Doc, appreciate you being with us, and we're kind of continuing an extended conversation that we've started here with you on pain, and kind of want to get into exactly when do you need to see a pain specialist? I mean, this is kind of a subjective topic. You know, everyone's got their own threshold, but, you know, in a general sense, when do you need to seek out your services?
So, you know, you're going to have aches and pains throughout your life. Some will come, some will go. The best way to ensure that it's going to go and it's not going to be something that lingers around is to get early treatment. So really there's no, I wouldn't say there's any time frame you have to wait to see a pain doc. The sooner that you can see somebody who is specialized in figuring out what's wrong and get you on a path to treatment will be to your benefit.
And regarding this topic specifically, pain, I was reading through some material here, you really, the pain specialist really should be sort of your primary care go-to for this topic.
Essentially, yeah. I mean, I consider us as the primary care for anything painful because we are able to decipher what's wrong, figure out what needs to be done, and then get you down the right path. A lot of what we do is in real time. I mean, when you put up an X-ray or an MRI, it's a stagnant picture. It's not something that shows movement, that shows what hurts when it hurts. What we do is actually use like real-time ultrasound, real-time X-ray machines, and really pinpoint where the source of the pain is so that you can get back to normal life.
Very good. Something else that jumped up at me was minimally invasive procedures that facilitate healing. I like the sound of that.
Yeah, I mean, you know, there are more invasive things that can be done, but it's often premature, or it really helps with the extreme situations. But in your mild to moderate pain, there's a lot of interventions that really you leave with nothing more than a Band-Aid, and they can be revolutionary as far as getting your pain under control. Okay, so we just want to get that mindset out there, thinking along this route.
That's right. If it has to deal with pain, your primary care resources right here. So
pain specialist.
We've got some information at the bottom of the screen to reach out to your practice for more information, and we encourage folks to do so. Doc, appreciate it as always.
Thank you, Doug.
Good intel
to
have.
See you.
Same here.
Thank you.
We're back with more after this. Stick around.
I'm Dr. Danesh with Pain Management Medicine. There are many misconceptions about pain management. Some people think we're end-of-life care, some people think we're just narcotic management. But really we're problem solvers. The body is a self-healing machine, and sometimes it needs our help to figure out what's wrong and how it can get better. And that's what we do. We're problem solvers. We figure out the best way to fix the problem so you can get back to your life. We treat the root cause of pain, not just numb you with narcotics. Pain Management Medicine, seeking the source behind your pain.
Welcome back. Their goal is to help you manage your pain without unnecessary medication, and one way they're doing that is through technology. We've got an amazing piece of tech right here. Dr. Danesh Maslam-Doost from Pain Management Medicine is here to explain how. Dr. Danesh, good to see you as always, sir.
Great to see you, Doug.
So we're completing an arc. We've been talking with you over the months about pain management and your approach to it, and appropriate that we're ending on technology, and we've got an amazing piece of technology here.
Yeah.
And by employing this, we can actually maybe kind of veer away from medication that we may have made a decision to take had we not had this look.
Right. Well, I mean, modern pain management, it's changed dramatically, and we really are able to focus down onto the root areas where it hurts. And with technologies like this, we can actually visualize things in real time, see it under movement. We can see things that previously were just invisible, like very small nerves. We were talking about Star Trek before coming back on, and this is really a step into the future, being able to see things in real time.
The future is now. This is an ultrasound machine, and what, 30 years ago, unheard of to walk in with a laptop-sized device here and be able to do what you can do with this. So let's show folks at home here exactly how you employ this and how it helps pinpoint that pain.
Right. So it's pretty easy. You just simply place the probe, and I'm not sure if you can see the screen, but if you can visualize the screen, you can actually see the nerves, the muscles, the tendons when you move your hand. Let's see if we can get that a little better. There you go. Can you guys see that?
Oh, maybe the screen went off there. Oh, there we go. There we go.
There we go.
Look at that.
Now, wiggle your fingers around.
Okay,
you can actually
so that's me wiggling my fingers.
Right, so you can see all the tendons, you can see the nerves, and we can do this anywhere in the body. Oh my God, what is that?
Uh-oh.
No, I'm just kidding.
Oh, come on, Doc. Don't do that to me now.
And so if there was an injury here or an issue here, we could actually see it, we could medicate it, we could treat it.
Okay, so up on the neck now.
Up on the neck, you can see all the muscles.
Wow.
We could actually see the nerves and the joints as well if we were to. Yeah, it's pretty amazing.
Okay, so using this device, we just get that pinpoint accuracy, get closer to solving this thing, and make sure we're not going down the wrong road in terms of medication or other forms of treatment that we may just be guessing at without this look.
Absolutely. I mean, maybe even 5 years ago, people would just do it based on anatomy. We can now see things, and we can put the smallest amount of medication that would help treat that in a very discreet, very pinpoint spot.
Okay, and then you close the lid and you're off to your next assignment there. That's incredible. All right. Well, Doc, we certainly appreciate it, and we hope you'll come back and visit us. Your visits here have been very informative, and this is something that so many of us live with, this ongoing pain. And how many of your patients have just gone on for years before they've taken the step to do something about it?
And it's really not necessary, and we can do a lot of things, knees, elbows, shoulders, anything we can do.
Very good. Well, we encourage you to check out that website at the bottom of the screen for more information, and I hope you come back and see us.
Appreciate it, Doug. Thanks for being a model.
Thanks, everybody, and hey, have a great day. Take care.